So once the researcher and interpreter attestation forms are completed and entered on the database, the baseline form will generate, as you can see here, with the clear bubble next to baseline. This form is essential as it contains minimization variables required for randomization. You must enter the PPE ethnicity, which is documented at screening, the PPE BMI, the PPE and PPS date of birth in order to allow randomization to take place. So I'll just click into this form, complete it quickly. So this is where the minimization variables are. So, is this for PPE? Okay, so go with 6. And then the same for the partner providing sperm. We'll put their NHS number, date of birth, height, weight, and BMI too. Height. Any previous pregnancies, so a table will pop up below if you put any number other than 0 in. So for the purposes of training, I'll just keep this to a 0. And this is the same with the PPS, has the PPS conceived with other partners. Then you'll go through their fertility treatment history. Okay, so I'll leave all this because I know that the minimization variables are in there, so we can proceed to randomization. This is another big one. At the bottom of the baseline form, under NHS funding eligibility, you'll put your sites or the couple's integrated care board in, and if they qualify for IVF, please communicate with couples. Any risk participation in the trial may have to their NHS IVF funding. Yep. Okay, so that's for the site staff. And then, as always, name the form, date the form. I'll leave that as incomplete, as all of these questions are incomplete, and you'll see that come up now when we save and exit the form. So all of these will pop up as they are unanswered, but if you ignore and leave record, you'll see that the randomization form has now been generated because all of the baseline minimization variables have been documented. And so click onto the randomization form. You'll need to go through a few checks. Please do not randomise the couple if estimated start date of treatment is 3 or more months in advance. So I'll just give an example. If it's the 19th of Feb, that would be what, over 4 months until the start date of treatment. So the database will prompt you, do not randomise the couple if there is more than 3 months expected between randomisation and treatment starting. So I will now put that. There we go. So are the couple happy to proceed to randomisation? Are they still eligible per inclusion and exclusion criteria? It will show you the minimisation, so the ages of the PPE and PPS there, and it will let you know that to be eligible, both partners must be aged 18 or over, and the partner providing eggs must be aged under 39. Have both partners completed their consent forms and are still happy to be randomised? And has it been paid? Has the first cycle for IVF been paid for couples who do not qualify for NHS funding? So once all the confirmations are answered, the minimisation variables will appear, and it will show you the randomising centre. So the site, in this case it's a training site, but in your case it will be your site name, the PPE ethnicity, the BMI of the PPE, and the age of the PPE. Once all questions are answered accurately, please ensure the member of staff randomising the couple is entered and sign off with the correct date. So as you can see now, the green prompt has told you that the patient is eligible and can be randomised. If you are ready to randomise, please set the form status to complete and save the form. So here we go. If we set the form status to complete, another green box will pop up below that. Patient will be randomised when you save the form. Save and stay. And you will see that if you go back, well, you save and stay, so you're already in the form, but if you scroll to the bottom, you will see the randomisation allocation, the date of randomisation, and the member of staff that completed randomisation of the couple. After randomisation, so the allocation was to IVF, as you can see here, IVF. After randomisation, the treatment CRF, which in this case is the IVF treatment form, will become available, and subsequent forms such as the laboratory form, frozen transfer form, post-treatment and clinical pregnancy outcome CRFs will become available as key data items are entered in the available forms. If a form is not available to use, check that the previous CRFs are not missing any key data. And following on from randomisation, the following ad hoc forms are available to select at any time following randomisation: natural pregnancy notification, serious adverse event, protocol deviation, change of status, and the non-trial treatment form. Please complete accordingly. Thank you very much for listening. We have just discussed baseline and randomization of a couple on the UNiTY database on RedCap. Thank you very much for listening. In the next video, we will be talking through the advanced reports function.